talk.
Thank you, Dr. Namrata and AIOC for giving me the opportunity to share my views on the subject of how simple it is to integrate elective procedures in your practice. Uh, uh, back home, I mean, we are a team of 5 and collectively 70 years of experience in eye care. What we do in this organization is integrate any advanced technology into practice. That's basically what we do day in and day out, and trying to help practices so that this transition becomes seamless. Uh, we've been hearing, we keep hearing about different technologies, how beneficial these technologies are and how good they do clinically to all of us, to the patients. Now, it's also important for us together to learn, how to integrate this technology, how to communicate the value to these patients, such that, you can subtly and, you can seamlessly and judiciously and, rightfully actually monetize the investments that you've made. And this topic is all about that. By the way, this happens to be one of the top 3 challenges that a clinician face today. The first happened to be, how to retain and motivate your hospital staff. The second happens to be, how can you monetize on the advanced technology. And the third happens to be, how can you increase the check-in to check-out of experience of your patients. So let's talk about it. So the first and foremost thing, why is it actually important to even have an advanced technology integrated in your practice? And I've listed 5 reasons why you should be, investing in advanced technology. Number one, it widens the basket of services, that today's modern patients actually are looking for, their visual demands. We've termed this one as the new generation elders, their visual needs are different. And that's one of the reasons why you should be widening your basket. Second, this acts as a differentiating factor from your neighboring practice, and we all know this. The third happens to be, this obviously helps you bring in more revenue to your practice. And this also helps in developing, your near advances in future. For example, learning curve. We all know that there's a little learning curve when it comes to astigmatic correcting IELTS, and and if you learn it at a later stage, all the advancements are happening in the toric platform. So it's obviously important that one learns this technology. And lastly, this is absolutely the right time. In COVID times, this is the absolute time where there is a heightened awareness about safety and disposability, and that's one of the important reasons why one should consider integrating and having and investing in advanced technology in a practice. So what advanced technology are we primarily talking about? So any elective procedures, any procedure, product, or service which reduces the dependency on glasses or enhances the safety, or even fastens the rehabilitation process, or just gives in a great check-in to check-out experience of the patient. These are all elective services and procedures which can be charged a premium, a decent amount of appropriate premium can be charged for this. I listed some very interesting top myths, and I was just hearing to the conversation, and a couple of them just popped up. Here are the couple of myths when it comes to integrating any advanced elective procedures in a practice. These are what practices generally think. And number one, and Dr. Sharma just brought in one of the questions, that number one biggest myth is, if and when patient asks, I will offer. Why do I have to talk proactively? And that's one of the biggest myths, that it really doesn't happen. The second happens to be, the biggest myth is, I cannot increase my chair time just for the sake of promoting a technology. And we'll talk about this, why this is a myth. The third happens to be, the biggest differentiation, this is very geography based, the biggest differentiating factor that practices try to make and try to communicate to the patients is, they say that, this is such an expensive technology, I'm giving you at a peanut price, posing that to be as a value. That again doesn't work well. And the biggest myth that one has as a practitioner all across is that patients do not pay. They do not have enough money, and do not understand. On that, I want to share a very interesting survey, done in India, not an American survey. That this is very much an Indian survey done with some 18 metros and mini metro towns in India, not long, just 2 years back. That 6 out of 10 patients in India are willing to pay up to 70,000 rupees for a laser vision correction. Up to 7 out of 10 patients are ready to pay 50,000 rupees for a cataract procedure. And this is the saddest part of it, where only 2 out of the 10 patients are actually offered a premium procedure. So I'm going to share today some very simple ways, with that shocking revelation, simple ways where you can together go back Monday morning and integrate these couple of tips just that I've learned from all of you all to integrate these procedures in your practice. Having said that, the biggest background, the biggest disclaimer is, of course, the biggest disclaimer is that, good surgical outcomes is absolutely necessary, is absolutely inevitable, and that's no substitute. Considering that to be granted, that there is good surgical outcome, which prevails. The first tip that I want to share with you all, which is important, is the self-conviction. And if you're not convinced about the technology, it will never show up in your practice's body language, the verbal, non-verbal interaction that you're making. It'll never show up. And that's why it's important that you get thoroughly convinced about a particular technology. Talk to mentors, visit webinars like this, but you need to be convinced. Otherwise, it's going to become something like, from the place where you wish that, the elective procedures would happen to somebody. When you're convinced about a technology, you would come to a situation wherein, and this happens obviously when you're convinced about a technology, that you feel that, every clinically suitable patient must have this particular technology into his or her eyes. So that's point number one. Number two, which comes from the survey that I just mentioned, that 2 out of 10 patients are actually given the options. And Dr. Nishant in his presentation shared very nicely that how, and I visited his practice, and I've actually visited all the practices of all the panelists that are here today. And I've seen Dr. Nishant's practice. Absolutely right. I mean, there's something correct about how patients are told about the advancement or the advent of any new technology for that matter. And that's my point number two. Let your patients know that that there is a technology that is available in your practice. And if you were to crib that there's not enough opportunity, there are several opportunities in your practice. Right from a pre-read material, from the reception to the checkout. There's several ways where this can be very strategically put forward, and this awareness can come in. Some examples what you can do is simple things like posters and stand days and so on, several other things. Now, the biggest mistake that happens, and even if you were to design a poster or an education material, or for example, a company provides you, many times you just don't think, practices do not think where to place it. Wherever they see a vacant wall, wahan laga do bhaiya, and that could be next to the washroom. And that's not the correct way. This is such an important science that you need to think and and spend some time understanding where to place these education materials. That's number one. You should be careful about. These days, we all are going digital. Patients are going digital, and simple things, and it's not at all difficult to have have QR codes. QR codes today. Google Pay, Phone Pay, and Paytm put together have close to 150 million users every day. And that many amount of people are actually aware of how to scan a QR code, and how simple it is to get information from there. And hence, very important is that simple education materials that you have with yourself, you can very easily turn them into a QR code, and have your patients scan this, or the caregiver scan it, and get them tutored while they're waiting. Nobody likes to download an application, in these days for a few hours or for 1 or 2 times. Hence, any web-based application that you have that you can develop, very simply you can develop, is something that you should look forward for. The next one is something which is getting very popular in India as well, which already is very much existent in many of the countries of the Western world, is the culture of sending the pre-read materials. Before they come in, you send them, of course, understood that not many people read them, but the caregivers are anyway doing their homeworks, as Dr. Namrata Sharma just said. Most of the caregivers go and do their Google work. While that is happening, might as well the caregivers might as well go through the pre-read materials. That really helps, when patients walk in and they are a little bit more educated than what it would have been earlier. With that, yet another interesting fact that I want to share. These are the top 3 things that patients does not want to see in a doctor, or dislikes in an interaction. Number one, what they really love to see is the doctors who take his or her own time, to make them feel, give them options. And again, it's just driving them through a fast food joint saying that A, B, C, D, E, F, G, H. The second happens to be a doctor who involves patients in a decision-making process. And that's the point I'm going to talk about. And the third, of course, is on personal discretion. Patients love to have doctors who share the telephone number so that they can be reached out at any point in time. However, what I'm going to share is point number 2 at length, wherein, how can you involve your patients in the decision-making process? And that's where the concept of chair time comes in, and this is something very, very, very important. There is no substitute of your practice chair time when it comes to having any new technologies brought in your practice. you know it cannot be supplemented with by any education material, and that's why you have to be mindful of the fact that this is something that you need to invest freehand. Use tools, use different videos. Just verbal counseling doesn't help, or simply just scribble around in paper, in a piece of paper. Show them, and if you want to explain flags, just draw them cataracts, show them the incisions and how the laser beam would let you open the cataract and access to the cataract and make fragments and so on and so forward. Eventually, as Dr. Nishant mentioned in his practice, eventually this you might have to give a larger chair time from your own side, but gradually, the chair time decreases when your staff shoulders the responsibility and they learn, how you're communicating with them. Yet another important thing is the fact that, optometrists are one of the most underutilized assets in a practice, and they can do a wonderful job if they have been made to talk, about. And they come at a very interesting place in the entire patient journey, where that bit of talking about this technology makes a whole lot of difference to the consultant and the counselors all throughout. So that's a culture that one can inculcate in a practice. And last, but the most important part is the concept of recommending. And with our experience, and when we visit a lot of practices, we see that practitioners many times hesitate, most of the times actually hesitate to recommend, thinking that if I were to recommend, it would mean that I'm trying to sell a particular process. Well, recommendation is not selling, and this is a skill and art that I've seen with a lot of practices who have been very successful. I've learned this very well. This can be learned as well. I give this example most of the times in most of my talks, is the difference between a traditional way of recommending versus a newer way of recommending. You all would have come across a situation wherein a patient would say, come to say, you give them the options, and the patient said, "Doctor, you tell us, what is good for us, which procedure, flags, multifocals, whatever, what is good for us." A traditional way of answering this question would have been, and this is what I see at Mr. Places, would say that, "Mr. Patel, whatever you decide, me and my team will do the best." And a recommendation format would sound something like this: "Mr. Patel, had I been in your place, for my father, I would have gone for this package. However, whatever you decide, me and my practice will do the best." Now, the patient necessarily won't walk away with a flax and a multifocal procedure, but will walk away with a lot of clarity with the second format of communication. And that's the power of recommendation that you should try. And everybody in your practice, in some form and format, if they're tutored, you should recommend, if you feel if the patient is clinically suitable and it makes sense that he gets this particular technology. Couple of quick techniques, and I don't call them tricks, which you can use, are these, that we strongly recommend. One happens to be on the left-hand side of the screen that you see is the lifestyle questionnaire. It's a simple format, simple questions that you can make, wherein the patient before the consultation answers about his or her visual needs, what he or she feels would love to do without spectacles, if she or she wanted to get rid of the spectacles after cataract surgery, what are the activities that he or she would want to enjoy, and so on and so forth. It has two benefits. One, of course, you're making the patient think about it, and thinking about it, so that they're better prepared. And secondly, for the counselors and the consultant, it becomes a starting talking point. Say that, "Mr. Patel, you just said that you do a lot of computer work, which is your intermediate distance, and you've given an opportunity, you would want to get rid of your spectacles," and so on and so forward. That becomes a very interesting tool. And with this intervention, we have seen that the adoption ratio of any technology is much more higher, especially for the multifocals and toric technologies, much more higher, because there is a two-way interaction that actually happens, and the patient has already said it, that this is what he wants to get rid of. So that's one. And second, there's a very interesting thing, and I wanted to share in this forum, is the toric opt-out form. That's how we call it. Several things to it. Now, if you would have offered, or you or your practice would have offered a toric technology, a toric lens to a patient, which you feel is appropriate, let's say two plus diopters or whatever. And for example, for some reasons, the patient, despite being clinically suitable, despite you feel is affording, denies that, he doesn't want this technology. Then what you do is, you ask them to sign a simple letter, And this is what the letter reads. It says, I, so-and-so, age so-and-so, hereby decide not to opt for the astigmatic correcting IOL. I understand that, by not choosing this lens, I will need to wear my spectacles for the rest of my life, and so-and-so, so-and-so, and you signed it, here this. So this is a very simple letter, but when a patient is made to sign this thing, we've seen that the reconsideration ratio is up to 50% high, and they would really consider them, rethink it, because they just have to sign it. And if patients ask you, why do I need to sign this? But what is it all about? And you say that, this is just a normal process that we include, because in our past, we have seen that, when patients, despite we offering these technology to our patients, they've gone to different practice, and they have been offered a toric technology over there, and they come back to us and saying that you never offered us. So this is just to safeguard us, saying that, we have given you the options. Try this out, in any letter format that you can feel, and you will feel that the patients will really start thinking that, here's something that I'm really missing out, and this is something which is close to handicap, say, which I'm letting go, and which could have been cured, which could have been addressed at some point in time. Of course, never to less mention about the patient counseling station. This is one of the most critical part of the entire patient journey, and for the success of any new technology in your practice, this is very important. With lots that can be talked about this, but 3 things that you can keep in mind: training, tools, and takeaways. This is how we do. Get your counselors trained well, both on the technology so that they understand, and the communication, what should be taught. Second is the tools, in terms of give them a lot of tools. The companies these days help you with a lot of different tools. The fact is that, many times they don't use it, because they're pressed on time, because, they're not forced to use it, or, they just neglect it. These are very interesting, important tools that the patients really understand. Everybody makes a lot of effort in developing these tools, which with your guidance, if they use these tools, simulation applications, models, or everything, the caregivers and the patient will only be able to better understand this technology, and we will be able to take an informed decision. And last is the takeaway, is the motivation part of it. I think at the initial stage, it's very important that, you can consider motivating your counselors by virtue of any form of incentivization, whichever works well in your school of thoughts. It doesn't have to be money necessarily, but whatever works well in your school of thoughts, it's appropriate that you do so that they walk that extra mile in the initial phases. Why it's important? Because caregivers today are the decision makers, and we all know this. They decide the fate of the elective procedure because they did. So hence, a couple of things: do not ignore the caregivers, by virtue of eye contact and talking to them. Do not engage into verbal counseling. Give them tools and resources to share with them, and do not hesitate to recommend. They really look forward for a strong recommendation. What you should be doing, hearing them out completely. As Dr. Namrata Sharma also mentioned earlier, that they have done their online homework very thoroughly, and they really want to vent out. Good thing is to give them time and listen to them. That this is what it is, and this is what they've learned. Give them relevant examples that they understand, and also bring the factor, the dependency factor. How with the help of this, your parents, will be less dependent. The dependency factor, and that clicks pretty well when it comes to caregivers. An irritated patient or a patient family will never be in the correct frame of mind to listen to a flax or a multifocal procedure. Hence, the check-in to check-out time experience, the overall patient experience, is very important as well. Now, where there are several things that one can do to improve the patient experience. Here are a couple of quick things that you can probably check over here. Number one happens to be is how swiftly you should have your patients checked in. After the check-in, get into a primary exam in less than 15 minutes. A non-attended waiting period really turns a patient off. Put your primary staff. Primary staff happens to be a front desk, to be much more polite. Let there be adequate seating arrangements. It doesn't have to be very comfortable seating, but there has to be adequate seating. A patient who is waiting for 60 to 90 minutes is definitely not going to be in the correct frame of mind. And have your washrooms cleaned regularly. These are a couple of very tiny things that you can just check box and see how you can enhance and have your patients in a better frame of mind when you're going to have that important conversation. In your practice, in your town, if you have the first mover advantage, let's say the first flax procedure, first image guided cataract surgery, and so on and so forth, hurry up. I mean, this is the best time to do. It's much more simpler. Everything will fall in your advantage. Here is a study here is a study from Harvard, where they said, there was a study done with 672 medical professionals, and out of them, all of them adopted newer technology. 70% of them were successful when they adopted the newer technology. So the chances of adoption of newer technology when you have the first mover advantage is much, much, much higher. You can do several things like to promote your technology. Can have your case file, your case file printed with this technology. The website homepage banner can happen. The WhatsApp announcements that you also get a lot of free PRs in your town, and so on and so forth. So if you have that advantage, you might not have that advantage for long. It's time to act right now. The elective procedure multiplication factor happens only when you have developed ambassadors, patient ambassadors in your practice. And that happens when you're able to generate a wow effect in them. All of us does that, but so most of the time the patients are clinically have the wow effect, but they are not emotionally, they don't have the emotional wow effect, which means they know, what probably they feel is this is how everybody sees what's the great deal about it. So they are happy, but they're not super happy to become ambassadors. And that's where, you can do a couple of things, which we call it the post-operative counseling. Spending that additional 5 minutes after the surgery, after the refraction, everything stabilized, and doing a couple of very interesting things, just to get that wow factor. Like, for example, on the left-hand side, you see astigmatism simulation of a patient who has undergone a toric lens. You can again simulate in the trial set a similar kind of astigmatism that the patient has, and you say that, this is what your eyes were earlier. Now remove the trial set, and this is what it is at this point in time. This is what we've done with this new technology. Or the one that you see on the right-hand side, which you can do with almost every patient, is the pre-op reading evaluation sheet. This is a simple paper, simple sheet, which has different sentences in different font size. Before the surgery, you make them read the patient a particular font, and then they take a signature of it. And after the surgery, when you see the refraction is stabilized and so on and so forth, make them see, and they will see, make them read, and they will read an additional line, and they've already signed. And then you say that this is what we've done. We have reached from here to here. These are tiny things that you do. They become very happy, and they then become your ambassadors, and they go out jumping from the chair and say that you must get yourself done. You must get your surgeries done here. You must get this particular procedure done. When it comes to pricing, I think more than the price, it's the complexity of the fee structure that really turns a patient off. So try to make your pricing menu much more simple. Simple things that divide your surgery types into whatever formats that you have: a standard, flax, 3D, whatever. And then your lens types into very simple format of standard and lifestyle lenses. In lifestyle, you could have a toric and PCL, and so on and so forth. Let the patient choose from a mix and match. You keep your fees strict. This is what it is for these lenses, and you can choose. You can use a standard lens with the toric or a flax with this. This becomes much more simpler. And these days, also it also makes merit that a lot of practices I've seen and we recommend that they've started charging about advanced diagnostics, a small premium to it, and patients have been paying very well when they've been explaining the value that is attached to it. This is almost my last slide. This is on the insurance corner. We all know that culturally, none of us want to pay beyond the sum insured amount, and that's why it is critically important for the success of the elective procedure, the premium procedure, that the insurance desk or the insurance person who is managing insurance is also well capable of handling the situation. And that's why you should not only have a lot of information and knowledge about the insurance, but also you should also be made aware of the technology, what it is all about, and then certainly being able to quote the value and the opportunity of the copay option that most of the companies today offer. That's something that can kill that particular barrier and sail through pretty well. But last but not the least, I think just like anybody else, one should do your homework. Take up 1 month every month, just spend a couple of hours just studying your practice. Total cataract procedures that you've done, the elective procedures, what were the dropout reasons, and so on and so forth. This homework is absolutely essential for you to propel even more stronger, and you'll come out. You'll really get some very fascinating facts as you move forward and you do this study every month. So finally, if I were to summarize, I think 3 things that I would say, as a mantra from our experience for having premium procedures in your practice. Number 1, inform completely, recommend wholeheartedly, and leave willingly for the patients to decide, and for them to decide in any of the elective procedures they do that they want to for themselves, and you'll see a lot of good success in your practice. So finally, in all these years, all of you practitioners have been busy giving time in your practice. This COVID time has actually facilitated to think and give some time on the practice. So please do think about it and see how well you can integrate and have your premium procedures more seamlessly integrated in your practice. You can also reach out to any one of us, and we'll be happy to guide you with any help that we can. Thank you so much for your time.
So, Shourav, thank you so much. I think we'll have to import you from out of Alcon into AIOS